Hello, this is Professor Bo Shen from Center for Inflammatory Bowel Disease at the Cleveland Clinic. I'm specialized in the treatment for Crohn disease and ulcerative colitis, as well as ileal pouch disorders. So as we know, Crohn disease has three forms: inflammatory form, strictural form, and fistulizing forms. The early of the diagnosis, the majority of the patient had the inflammatory form, and as the disease progressed, the patient developed complications that including stricture and fistula. So medical therapy is really targeted for inflammation. When you have a complication, especially mechanical complication such as the stricture and the fistula, the main therapy should be mechanical too. Mechanical therapy including two forms: endoscopic therapy and surgical therapy. Endoscopic therapy and surgical therapy each has a pro and cons. Surgical therapy more effective but more invasive, and they run the issues of the post-operative complications as well as post-operative disease recurrence. Endoscopic therapy, which is more effective than medical therapy in terms of stricture and fistula, not as effective as the surgery or as definitive as the surgery, but it's less invasive and carried low risk of the complications. When you do the endoscopy, it is important to remember principle first, technique second, and followed by device and equipment. So we should understand what's a principle. Important principle for the pathogenesis or disease course of the inflammatory bowel disease, especially Crohn disease, is no inflammation, no stricture. No stricture, no fistula. And no fistula, no abscess. In other words, if you are to prevent the stricture and the fistula, we control the inflammation first, typically by aggressive medical therapy. When the complication or stricture or fistula develop, we have some way to treat. Now, endoscopy has emerged as a valid tool for treat both stricture and fistula, as well as abscess. In this article, we are focused on the treatment of Crohn disease and the Crohn disease associated surgery related is to understand the disease process. No inflammation, no stricture. No stricture, no fistula. And no fistula, no abscess. So it is important to control the inflammation with aggressive medical therapy first. Then when stricture and fistula develop, it is important to remember you use a mechanical force combined with the concurrent medical therapy. So this article, we will focus on the treatment, particularly in this endoscopic treatment for the Crohn disease associated fistula and abscess. It is important also to remember the fistula is different than the sinus. Fistula has two openings, internal opening and external opening. And the sinus, typically associated with an anastomotic leak, has only one opening with a blind end. The treatment for fistula, it is try to open up the external or exit opening and try to close the internal opening. And do whatever possible, if it's feasible, to open up the fistula tract. So endoscopic fistulotomy probably is the most effective way to treat the fistula. But however, the fistula amenable for the endoscopic therapy use a needle knife or use IT knife, or those the fistula is at the distal bowel at the rectum or ileal pouch, and the fistula should be superficial. Now, if the fistula was deep or at the right side of the colon, or injection or spray of the fibrosing agent, such as hyperconcentration glucose, doxycycline, and their study reported that stem cell injection in the fistula tract. And we also can do the clip. There are two kinds of clips, through the scope clip and over the scope the clip, and each has the pros and cons. And through the scope clip, it's weaker, but easy to apply, and over the scope clip is stronger. We can close the internal opening of the fistula, and at the meantime, we may use a needle knife or scalpel to open up the exit or opening or secondary opening of the perianal fistula or enterocutaneous fistula. In summary, endoscopic therapy for inflammatory bowel disease, particularly Crohn disease, is a new field. Please remember, the combined approach is critical. With the medical therapy, endoscopic therapy, and surgical therapy, when we do the endoscopic therapy, please make sure we will have the surgical backup. Thank you.